I see men in their 20s all the way up to their 80s. And a lot of them are coming in with similar concerns. They
Mm.
verbalize their concerns in different ways. The terms they use are different. But what every man really wants to know is this normal? And what can we do about it? When should I worry? And when can I wait it out? I have yet to have a single guy come in and show me a picture of a porn star's penis and say, I want this one, you know? And oftentimes, if I go, let's say, to get a haircut and color, we'll go into the salon and we'll say, I want you to make my hair like this. Or if a woman's
Yeah.
going to get breast implants, she might, get some photos of someone who has a breast augmentation and say, I want my boobs to look like this. I've never had a man come in to say, I want my penis to look like this, right?
Yeah.
They understand the penis that they have, and they're very realistic with their expectations.
Dr. Amy Pearlman, thank you so much for coming to Sex in Space and adding your very valuable time for us. We're here to talk about penises, I guess. That's an area that you specialize in.
For better or worse, we can talk about whatever you want, Tim. I know you cover a lot of topics, and we can definitely cover penis talk today.
Well, let's talk about penises. Go on, why not? Twist my arm. So really interested to get your take based on the work that you do. I want to give us a little rundown on your background. Can you give us a little rundown in your own words?
Yeah. So I'm a urologist. I did 5 years of urology residency, and then I did 1 year of specialty training in North Carolina, learning really the nuances behind erectile dysfunction, treating guys with low testosterone, male infertility, and reconstruction of the male genitals. It's funny because looking back when I was deciding in medical school what specialty I wanted to go into, my parents were very encouraging of me becoming a urologist because the other specialties I was considering was emergency medicine and pediatrics. And
Yep.
they really wanted me to give urology, a real consideration. And looking back, my mother had passed a kidney stone. So she thought I was going to be a specialist in kidney stones. And looking back now, it's like jokes on her because now I specialize in male external genitalia. Um, but so I did all of that training, became an expert in that, and then I started my career on faculty at the University of Iowa. I was there for 4.5 years. I built the foundation of my career there. I directed the men's health program there. And then I actually started my own practice about 3 years ago called Prime Institute in Miami, Florida. My current practice focuses on helping men and women really have the best sex of their lives at any age. And I also treat hormonal and genitourinary considerations. I have the
Okay.
best job in the world.
That sounds amazing. That sounds amazing. So there's me thinking it was just penis fillers, but no, absolutely, that's huge, broad church
Well,
standing
I
of
treat
was.
like quality of life concerns that affect everyday
Yeah,
men.
that's it. I
And
think that's
yeah. And so based on my area of expertise, I can sort of decide how much of that I'm able to treat and what I might need to refer out.
mm,
And when it comes to things like hormone health and sexual health and genital health, you can't really like treat one 100% and do your best at it without acknowledging the interactions with the other aspects, right? So let me give you an example. I could just focus on, let's say, erectile dysfunction. But the reality is, a lot of guys who come in who have long-standing erectile dysfunction also have changes in their penile size. They lose length and they lose girth. So if I can't acknowledge and address penile size and genital concerns, then I'm not really going to help that guy reach his maximal potential when it comes to the bedroom. But
mm.
also, if I'm addressing his erectile dysfunction and I don't address any hormonal deficiencies like low testosterone, then he's going to require more invasive therapies to treat his ED. Then, if let's say I put him on a medication like a daily Cialis and optimize his hormones, he's going to respond better to that pill. So we can't silo it. And I think that's where I've broadened my treatment options is really honing in and addressing all three of those.
I think it's interesting. So now, typically, men are quite bad at going to seek treatment and stuff like that. At what stages do you find that your clients in the life of the problem that they're having? What stage do they bite the bullet and come to see you? Where are you seeing them? Are you seeing them at a really desperate stage, or are they trying to stave off a problem that they know, you know, is a small problem that hasn't quite ballooned yet into.
Yeah, Tim, I see them really at all different stages. I have a really unique practice in Miami where, for example, I was looking at my schedule for later this week, and on Friday, I have another doctor coming in, and he's coming in for a wellness visit. Like a
Okay.
Wellman's visit, right? As a woman, I could call a gynecology office and I could say, I want to schedule my annual well woman's visit, and nobody would blink an eye. But there's not really any such thing as a well man's visit. And what a beautiful thing that would be. And I
Mm,
think here's the issue, Tim, is like as a woman, when I was a teenager, my mother said, I don't know, maybe I was like 16 years old, something like that. And I remember one day she said, Amy, it's time to see a gynecologist. And
yeah.
I dreaded that visit for weeks leading up to it. I didn't know what to expect. I was scared with my, just imagining my legs being, straddled and a weird exam. And I didn't know if it was going to be painful. And it was like the unknown.
Mm,
And then I went there, and honestly, it's so interesting. The only thing I remember from that visit is that she took me into an office and just sat me down and talked to me. And
amazing.
I'm
Yeah.
sure she did an exam. I'm sure she examined me. I'm sure she did a pap smear. And you know what? I don't remember it. I remember how great of an experience that was. So,
Mhm.
women, we get plugged in early before there's a problem for routine screening. Then if we have a child, we have to get plugged into the healthcare system again. For men, there are no milestones like that. When does a
Mhm.
man first see a doctor? I mean, it's when he has a real problem. And so that could be like in his 50s. And oftentimes, what is that presenting issue that a guy comes in for? Maybe a urinary issue. And he goes to see a urologist and he gets a finger up his butt. So why would a guy want to engage in the healthcare system if that's what we do to him?
Mm.
And so I'm on this mission to really create this well man's visit where it is acceptable and encouraged for someone like you to see someone like me and to say, look, here's my health history. I'm, pretty healthy. I have a little bit of concerns here and there. Tell me what I need to know with the information I provided. And then what we would do is we would go through just basic hormone health. We could check some labs. We can go through erectile function, how the penis works, why it might not work. So I'm on a mission to really normalize that conversation. I see men in their 20s all the way up to their 80s. And a lot of them are coming in with similar concerns. They
Mm.
verbalize their concerns in different ways. The terms they use are different. The degrees of severity are different. But what every man really wants to know is this normal? And what can we do about it?
Mm.
When should I worry? And when can I wait it out? And we talk a lot about that during those educational visits.
That sounds amazing. I mean, sign me up 100%. I mean, that sounds like an absolute dream.
'Cause you don't have to have
Um,
a problem, right? I
no.
mean, I wanna educate people before the problems start because so much of what I do in treating quality of life concerns that affect everyday men are preventable. You just don't know that yet.
Mm. Absolutely, and I mean, the other thing is, it's a big conversation, that I'm sort of in that bubble, I guess, right now. Like I said, 40s. Lots of people are talking about hormone health and stuff like that, and of course, I don't know anything about that. So, and I know that that does translate to potential issues, sort of later on in life. So yeah, why not? Why not come and find out how you're doing from a hormone perspective? So you say that you got clients from 20s all the way through to 80s. Um, just give us a brief, flavor of the sort of things they are coming in for.
Yeah, so I have a lot of patients coming in with all types of sexual function concerns. Oftentimes we simplify it and we say men come in with ED. It is way more broad than ED.
Mm,
It's issues getting erections, maintaining erections. It's ejaculatory function. Some guys orgasm too quickly. Some guys, it takes them forever to orgasm or they can't orgasm at all. It could be pain or discomfort with orgasm. It could be change in ejaculatory volume, change of the sensation of orgasm. I see a lot of guys for penile size concerns, whether they have been stable in terms of their size their entire adult lives, or maybe they've lost length and or girth as they've gotten older and have gone through certain things in their lifetimes. Let's see. And then I see guys who have low testosterone issues, and the symptoms for low testosterone are extremely broad. It really, testosterone impacts everything from the head to the toes. So it could be, Amy, when I wake up in the morning, I've lost some pep in my step. Might testosterone help me, right? It's fatigue, it's inability or difficulty gaining muscle mass despite putting in the work at the gym. It's
Mm.
difficulty losing weight, could be depressive and or anxiety symptoms, difficulty with sleep. And a lot of men, I mean, you're in my prime age demographic for people that come in to see me. So men hit their 30s and 40s and they wonder, is this just what it is to be middle aged, right? Or
Yeah.
is there something wrong? Is there something that I can optimize? And you don't necessarily have a diagnosis. You don't have high blood pressure. You don't have diabetes. But a lot of men are feeling it like they're kind of status quo and they wonder, they're curious, could I feel better? I
Mm.
saw a patient just earlier this afternoon. I put him on testosterone a couple of months ago and I was asking him how he was doing. And he said, Amy, when I wake up in the morning, I am ready to go. I feel like I'm 20 years old. I have this pep in my step and I am just loving being on testosterone. And this guy didn't have any problems. But the way that someone wakes up in the morning will dictate how he goes about the rest of his day in terms of his relationships, his productivity, and his overall quality of life. And I take that very seriously. Now, does testosterone therapy, is that a cure all for every malady? No, absolutely not. But for some people, it can absolutely be a game changer. So, what I encourage young men to do is get some data points. You don't lose anything from data. And so I
Mm.
don't like create problems when they don't exist. And I don't always treat numbers, whether they're normal, low, or high. But if, let's say, someone feels fine and they're 35 years old and we check their testosterone, then we know what their testosterone level is when they feel fine and they're 35 years old. So, what
Yeah.
happens when they're 45 years old and maybe have more fatigue and some of those other symptoms that I described? Well, if now their testosterone is half of what it was when he was 35, it's that delta, that change that he's likely going to feel. And that just gives me more information to say, hey, maybe it could be his testosterone level. But oftentimes we never have a baseline.
That's it. I mean, I think my I was like, oh yeah, that's true. When you talked about like that just assumption that this must be middle age. This is what it's. This is normal. Like oh my back. Like it's suddenly, all these things that I guess you just kind of live with, and you see. I mean, I see it in my mum. As she gets older, it's just a narrative that you tell yourself. If you think, oh well, look at me getting older. But I like that approach that it doesn't have to be like that. But also data points are absolutely bang on. So what sort of things should people be looking for in that data? Is it are you just looking to ask them, how do you feel in the morning on a scale of 1 to 10? Do you wake up with an erection, or you sleepy? All that, like, is that kind of questions you're asking?
Yeah, just a lot of general questions.
Yeah,
How do you feel when you wake up in the morning? Do you feel refreshed? How's your sleep quality? Walk me through what you eat in a day. Walk me through your
yeah,
exercise routine. I ask about energy in the afternoon. Hey, when you're working out at the gym, do you feel strong? Your current weight, are you what you typically are? Or are you up or are you down in your weight?
yeah,
Do you have any like anxiety or depressive symptoms? Very basic questions. And if people kind of check a lot of those boxes as having issues, yeah, I mean, those symptoms could be due to 30, plus different things. But the relevant question is, okay, I acknowledge that yes, this person has two kids, right? He's at like the top of his career. His sleep is not that great. His dog keeps waking him up at night, right? So I could blame those symptoms on every single one of these life stressors. But if he also has low testosterone, the question becomes, if I optimize his hormones, can I help him?
yeah.
And oftentimes, if he wakes up and he has more energy, then he can cope better with these typical life stressors that a lot of people are facing.
And so from doing like blood work, etc., you can see what an average, or sorry, if you would see that the, I don't know, hormones are below average, I guess. So you would also have a good guess that potentially there's room for improvement, and it might improve some of those things that he's presenting with, right?
Yeah, the labs have to be taken in context. So I
Yeah.
ask a lot of my patients, have you ever had your testosterone level checked? A lot of them have said yes. And they say, I was told it was normal. And I say, Get me the number if you can. And if you can't, let's check it again." Because the number is actually very important. And I say that because the reference range for normal is a huge reference range.
Right.
Depending
Yeah.
on the lab, normal could be 250 to 1,000. So someone, who's 45 years old could have a level of, let's say, 400, but could be symptomatic and could benefit from testosterone therapy. So I'm not looking for reasons not to treat someone. I
Yeah.
define how this therapy could potentially hurt someone if I put him on testosterone. And it's pretty, when you use typical doses that we would use in the clinic, it's pretty challenging to hurt someone. The big question that I ask all of my male patients is, are you interested in current or future fertility? Because if I put a man on testosterone, I can completely wipe out the sperm in his ejaculate in a very short period of time. And that's how I could hurt him. And then sometimes we'll make the blood thick, we can raise the estrogen, but all of these things we can deal with.
Yeah.
And it also, the testosterone conversation is also relevant to sort of genital health and, the topic about penile size, because it all goes to, how does someone feel about themselves when they wake up in the morning? And what does a guy do oftentimes when he wakes up in the morning? He goes to the bathroom, right? And oftentimes he's walking by the mirror to go to the bathroom, and he might, sneak a peek in the mirror and see what his penis looks like. Or he gets out of the shower and he's shaving in front of the mirror, right? And he sees what his penis looks like. And so my goal is not to try to tell every man that he needs a bigger penis. I am all for body acceptance. But for the guys where their penis size bothers them, and they want to like what they see in the mirror, we now have safe options to help those guys.
Mm.
And just like I said, my mission was to help normalize conversations about this Wellman's visit to get guys engaged in their healthcare earlier on. I'm also on a mission to help guys understand what the safe and less safe options are for penile enhancement so they can truly make informed decisions.
Yeah. So let's move on to penises then, because I think it's really interesting. I um absolutely agree. About how you feel when you come out of the shower, that kind of the naked look. It's really raw. You're not always in your best posture. You catch a glimpse of yourself kind of bending over to pick up a towel or something like that, and it's like, oh no. um, but it's interesting, and I agree that, yeah, any any enhancement, if it's safe, like, is can do wonders, like, not just physically, but mentally as well, and kind of address just how you're feeling. Could give you that extra boost you need to, I don't know, yeah, go back, hit the gym, or get back out on the dating scene, or I don't know, whatever it might be. I can imagine there's huge knock-on effects. So yeah, give us a brief, broad one on why you see people coming in and wanting the penis enhancement stuff then.
Mhm. Yeah, so I see a lot of guys that, have seen, let's say, an ad for something, and so they call and make an appointment. Maybe they haven't been thinking about it for that long, but a lot of the men that I see have been thinking about it for a long time.
Right.
Some of them for decades. The oldest guy I've probably seen for penile enhancement was like in his 80s, maybe like mid to even late 80s. And his thought was, if not now, when? And I totally get it, but
Yeah.
he's been thinking about this for literally decades. And a lot of guys know that they have a normal penis. And if you look online, like, people can look up easily what an average size penis is. And people typically, when they come in, they fall somewhere in the middle of a nice bell shaped curve.
Yeah.
And most of my patients know this. What I like to really emphasize in this conversation that I think is really important is that, because you ask, are your patients coming in, are they desperate for help?
Mm.
And my patients, for the most part, are not coming from a place of deficiency or desperation. They're actually coming more from a place of abundancy, right? They know they're normal. They want some enhancement. They know it's not going to change every aspect of their life, but they have realistic expectations for how it can help. And so I really enjoy seeing those patients. Now, it's a very polarizing area within urology and the healthcare system, right? Because a lot of these guys are, quote unquote normal, right?
Hmm.
So, what problem are we fixing, right? And we're so used to sick care in medicine, and we're not used to healthcare, preventative care, or optimizing care.
Yeah.
And so, a lot of these guys are kind of like the worried well, which I love seeing in my clinic. And a lot of these guys, their sentiment is, I know I'm normal and I don't want to regret ever having met you. I'm coming to you because if I want to get rid of the enhancement, I know that we can. What I tell people who are coming in, for, let's say, for permanent options, which I don't really see very often, is with permanent options come potentially permanent consequences. And as a healthcare provider, I am very risk averse. And also to characterize my patients, they tend to also be risk averse as well. They want
Hmm.
options that are reversible, right? We actually recently presented a study where we surveyed about 432 patients who completed the survey, who had filler done, and this was under the foul fill protocol. And if you're okay with it, are you okay if I share some of the results?
Yeah, go for it.
Okay, so we wanted to characterize who are these guys that are coming in for filler for girth enhancement, and what does filler do for them? Okay, so before they underwent treatment, 10% described the quality of their intimate relationships as very strained or strained, and 62% describe their quality of their intimate relationships as healthy or very healthy. That goes to this abundance mindset. These
Mm.
guys are coming in and they already have pretty healthy intimate relationships. Okay. The next one, in terms of confidence about sexual performance, about 17% reported feeling very unconfident or unconfident about their sexual performance. And nearly 50%, so 47%, felt confident or very confident. Again, going towards this abundance mindset. In terms of physical appearance, about 37% expressed being very unconfident or unconfident, and 30% felt confident or very confident. So I would kind of expect that because they're coming in and they know that this is going to help with their physical appearance.
Yep.
And then after treatment, 80% reported improved satisfaction during intimacy. 75% indicated their partner experienced improved satisfaction. 52% reported increased frequency of intimacy in their relationship. 81% reported improved self confidence and overall well being. And 55% noted an overall improvement in their relationship with their partner. So these guys are really coming in mostly from satisfactory relationships, right? And we're able to enhance it, but they're not coming from a place of desperation, which I think is really important to note.
Yeah. Ah, that's very interesting. But yeah, I think listening to those stats really kind of gives you draws that exact picture. It's like that it's a choice that they're making to look to enhance, because like, why not? If they're having great sex, I suppose you could do, I don't know, numerous things, and probably are doing numerous things to enhance that in numerous ways to make it more fun or whatever. And I guess this is one of those options available to them, right?
Yeah, and look, I
Yeah.
have some guys that get cosmetic work done on their face, like Botox or fillers.
Hmm.
And once I do the filler procedure on their penis, they realize, oh my God, it's just like me getting filler in the face. It's like no big deal. It's
Yeah.
almost anticlimactic actually for a lot of patients. Now, I never want to downplay this procedure for people because it provokes a lot of anxiety for people. They've been thinking about it for a while. So I don't want to just tell guys, it's nothing. Don't worry about it. Let's just do it. Let's go next door. Drop your bottoms. Like, I would never say that. But it's great after the procedure where these guys kind of take this breath of relief that, oh
Yeah.
my God, that wasn't that bad. I can't wait for the next session.
Yeah. Oh, that's cool. So the in terms of now, if we just sort of just an aside, there's that Olympic story about the ski jumpers getting so some of them getting this treatment, and it's kind of strange and weird. And I never knew any of it. I didn't realize that they get 3D scanned to fit their suits and stuff like that. But I did read that they got this penis enhancement, and it was relatively small amount of growth, I thought, for a large amount of gain. That's just literally in the
Like
context
in
of this.
terms of their athletic performance, you're
In
saying?
terms of
Uh,
the aerodynamics, I think it was,
yeah.
yeah, like literally,
That blew
like
my
what
mind too.
1 centimeter of suit can add like 5 meters to flight time or something. Anyway, I mean, but as an aside, what I'm interested in is how much growth are people generally looking for? What can sort of be achieved with a normal patient who's not a Olympic ski jumper?
Yeah. A lot of my patients come in and they're looking for a natural appearance of their penis, right? They
Yeah,
want to look at their penis. They want someone else to look at their penis and say, wow, that's a nice looking penis, rather than what work did you have done, right?
yeah,
And so a lot of my patients are interested in half an inch to an inch increase. I had one guy submit a consult yesterday and he's looking to increase his penis by 3 inches. Now, I've done that before for some patients. Does it look natural? Like, if you saw that guy in a locker room, would you say, "Oh, that's a very natural looking penis"? No. No,
yeah,
it would not look natural, right? Because we're not injecting the head of the penis. So depending on the size of the tip of the penis, the proportions, if you increase the girth of the shaft of the penis significantly, the shaft is gonna be significantly larger than the head.
yeah,
Now, I have some patients where that's the case and it doesn't bother them. Sex for them, we talk about filler as being this physical appearance thing, right? Also, it can impact mental health, as we discussed, like with this study, but it's also a functional aspect, right? So, my patients that tend to really like a lot of filler, sex feels so much better for them. That's functional, that
mm.
they don't necessarily care how their penis looks to some extent. They just like how it feels, how it functions. So the limitation would be what I tell patients when they say, how big can I get? Is I tell them, well, we're going to do this in stages. So we don't actually have to decide from the get go how big you want to get. We can see how the size looks on you as we get bigger and can determine if you want to continue getting bigger as we go, which is the nice thing about this procedure in particular.
Yeah, I imagine that's a nice way to approach it. But also, I was just reminded then, like I was sort of saying before, like I'm a straight white guy in his 40s. I've been exposed to online porn, but I haven't seen a lot of penises, to be honest. I'm sure you've seen plenty, but the I did just through doing this podcast. I was shown a Australian photographer's website, and she does these things called solicited dick pics, basically, where she does vagina galleries as well, vulva galleries, all different types of artwork and stuff like that. And so she's got these photo libraries of a really broad range of genitalia, and I think her mission is to normalize that there is no real normal. Like you said, it's a bell curve, and there's a great variety out there of all shapes and sizes and colors and proportions and stuff like that. And that for me was quite interesting when I saw that, because I was like, I think it's the broadest spectrum, if you know what I mean, of penises that I've ever seen. Um, and it didn't look like porn to me. Like, do you know what I mean? When you're seeing, a whole bunch of locker room penises, and there they all are, there's hundreds of them. You're like, oh, actually, yeah, there is a there isn't really a normal, but you're absolutely right about the proportion thing, and in that variety as well. Obviously, there's some that are, you know, have got a much bigger head, or quite skinny, in the shaft, or the other way around, or and so you can see that a procedure like this, if you wanted to just go, right, I want the shaft to match the head, I guess go for it.
Yeah. And the thing
Yeah,
is too, I oftentimes will tell my patients if they don't think that they're normal, like I'll tell them what average penis size is. Sometimes I'll pull
yeah,
up a graph and I'll show them, where they show up on the graph. Now, if
yeah,
someone is below average, I typically am not going to point that out. Right. If they're at like the 40th percentile, then I wouldn't. But let's say someone's like at the 55th percentile, they're at the 60th, but they think they're way lower than that. I'll show them where they are in the graph. And again, they have like this
yeah, I
breath,
bet.
this sigh of relief that's like, oh my God, I am normal. Now, my job, I'm not trying to convince them just accept yourself, right? So they understand that they're normal. They still want to be enhanced, which is totally fine. So I think it's good for people to understand what normal is
Mm,
and then what enhancement could look like for them.
yeah. No, I think that's true. Like I mean, yeah, understanding what normal is, anything that can, particularly if people are coming in, like, it doesn't sound like they are for you that much, but if they're coming in with, you know, real sensitivities about how they look, um, I can see that's where it gets a lot trickier. Like you said, if you have to navigate someone that's under the average or something like that.
Yeah. But it's just like
Yeah,
any other body part, right? Like, what is a normal shaped head? What is a normal shaped nose and ears? I mean, there's
yeah,
a variety. And the reality is, like, there is no normal. There are
mm,
averages based on studies that we do. That, one study, it's like one of the largest studies that looks at penile size is like 15,000 people. Okay, that's 15,000. In the scheme of things, that's not a high number to understand what the average sizes are.
yeah, yeah. No, not really. Not when you're looking
So
at
we do the
billions.
best with what we have in terms of the information, but it's not capturing the true average. It's not
Mm,
capturing the true average of a guy that's in the locker room, when he's in like 8th grade.
yeah,
And what I hear from a lot of guys is they compare themselves when they're in a locker room. They feel like they're the only growers and everyone else in the locker room is a shower. So when their penis retracts, they get very self-conscious about that. And
yeah.
what I think is very important when I do these visits, and you had kind of mentioned earlier in the podcast how somewhat broad my area of expertise is. And I like to keep it broad because when guys come in, let's say for enhancement, that's not where I begin the discussion.
Hmm.
Because what I know they're going to verbalize during our meeting sometimes are things that they've never verbalized to anyone before. And I just met them. They are a complete stranger. I am a complete stranger to them. So I like to broaden that discussion. And I will say, before we get into the reason for today's visit, I just want to learn a little bit more about you. Is that okay? And they're always like, yeah, that's great. And I say, okay, do you have a primary care doctor? What do you do for a living? Walk me through a day in your life in terms of what you eat and your exercise. And then after we've developed rapport for sometimes it's 30 minutes to an hour and a half, then we'll get into the size discussion. But I never start even that discussion by saying, how big do you want to get? I
Mm,
say, okay, like do you have concerns with length or girth? Where do you think you currently are? Where are you hoping to get? A lot of these guys, they don't know where they are. They don't know what their measurements are. I think a lot of people, like lay people, would think these guys come in and they keep spreadsheets of their penile size. Like, this is my exact length. This is my
yeah,
exact girth. I want to be exactly this. Those are not my patients. I maybe have had maybe two patients that came in with they said, "Oh, I recently measured my penis and these are what my measurements are." So a lot of guys, again, it's this curiosity of, "Oh, let me look at your models." Like for example, I'll show you like two here that show different girth sizes.
yeah,
So this one, and if we were to measure the circumference, is 4 inches, and this is 5 inches. So I'll have them actually like hold up the demos when they put their hand around it. They can kind of estimate how big they think they are at baseline, and then they'll put their hand around a bigger one and kind of tell me, "Oh yeah, I would like it to feel like this, where my fingers are barely touching," right?
yeah,
And that's how they kind of get a sense for it. But they can also see what does an inch increase look like, and I think that's really helpful.
yeah. Seems like quite a bit to me, but
Yeah. So I
yeah.
want to ask you more, Tim. Like, as a straight white dude in his 40s, what do you want to know about penile enhancement?
I'd have so many questions. I think flaccid versus erect, or sort of how it shows up in those those two scenarios. I'd be interested to know.
Well, let me tackle
Just
that one first. So that's a
yeah, go
really
for it.
good question. And when we do the measurements, we're typically measuring the penis when the penis is flaccid before we do the treatment that day. So can I say that it's a 1-to-1 ratio, that the
Mm,
increase that the guy gets in his flaccid girth is a 1-to-1 increase in what he gets when he's erect? And I can't say that because we're not measuring the erect state and the studies are not measuring the erect state. But I ask my patients, "Oh, since the last session, have you noticed any increase in size?" And more of my patients will say, I especially notice it when I'm erect. So I'm guessing it's about a 1 to 1, and maybe even sometimes it could be even more than that. I don't exactly know how that would happen because when we put the filler in, it's a little bit like soft and squishy. You can just kind of pinch it on the sides. It just feels like some tissue on the sides. You would think when the person becomes erect, it's going to compress the filler and maybe not have as much of an increase in girth. But
Mm.
I suspect that also when a man becomes erect, he's also just pulling more fluid into the penis. And filler loves fluid. So that's how I would imagine that maybe they get even more of an increase when they're erect with the filler.
Yeah, because I think it's interesting to think about. I think a lot of what you've kind of talked about in terms of, I don't know, maybe it's how people are feeling, when they catch that glimpse of themselves, in the mirror or in locker rooms or something like that. Like that's normally, unless you go to different locker rooms than I do. That's a flaccid penis state that you're
Hmm.
talking about there. And then yeah, then you've got your sexual performance with your partner and presenting and showing up um in those spaces. So I think, yeah, that's why I asked that one. I think it's interesting that it's not. And I think where my brain was sort of going and my assumptions with this conversation before speaking to you is that people potentially just want, that big erect penis that they see in porn or something like that, and maybe that's kind of their benchmark because of the kind of proliferation of online porn these days and all this kind of stuff. But yeah, no, I think it's definitely much more nuanced and more interesting to know that it's both, that it affects both those stages, but also that people are coming in, um, you know, for that, you know, for so that how it is when it's flaccid and erect, I think is just, yeah, it speaks to a kind of broader conversation and what they're trying to achieve with this. Is it really interesting?
Yeah. And by the way, I have yet to have a single guy come in and show me a picture of a porn star's penis and say, I want this one.
Yeah,
And oftentimes if I go, let's say, to get a haircut and color, we'll go into the salon and we'll say, I want you to make my hair like this. Or if a woman's
yeah,
going to get breast implants, she might, get some photos of someone who has a breast augmentation and say, I want my boobs to look like this. I've never had a man come in to say, I want my penis to look like this, right?
yeah,
They understand the penis that they have and they're very realistic with their expectations. Now, to go back on your point on what you guys care about, how their penis looks when they're flaccid, when they're erect, or both. I mean,
mm,
for a lot of guys, it's both. They want it to look good when it's flaccid and erect. I have some guys that say, well, who cares what it looks like when it's flaccid? No one's seeing my flaccid penis. I just care what it looks like when it's erect. And I have other guys that say, I love how my penis looks when it's erect, but I want it to look better when it's flaccid. I get really self conscious when I'm flaccid and I get out of a cold shower and everything is retracted. But I'm fine when my penis becomes erect.
yeah,
And the nice thing when we do the filler procedure, which we inject the hyaluronic acid, is the penis is typically in a flaccid state. So I can see how the filler is going to look in all different states, right? I can kind of like squinch it up a little bit to see when everything is like fully retracted. I can put it on a little bit of stretch to see what it looks like when it's flaccid but not retracted. And then I can put it on full stretch to mimic an erection to see how the filler would look in that state. But I have a lot of guys that are bothered by retraction, and we haven't done a study on this, and I haven't actually seen this published to date, but looking at what is the impact of filler on penile retraction. And penile retraction is normal, right? But it is bothersome to a lot of people.
mm,
And what I found actually with a lot of my patients is their penis doesn't retract as much once they have filler in. And I think it could be due to a couple different reasons. One is there's more weight in the penis with the filler.
yep,
And two, when we put the filler in, we inject typically the sides of the penis in between two layers of fascia, which we call Buck's fascia and Dartos fascia. So my guess is like when the penis retracts, you have retraction of those muscles. And I think the filler probably messes up the ability for the muscles in the penis to retract.
yeah. Interesting. So, in terms of if this is I mean, we're you know putting this conversation out there, you do the same. You the same thing in terms of people's exposure and normalization of this. Are you finding people are more clued up when they come to see you about this?
Yeah,
Is it
my patients
something?
come in and they're incredibly educated.
Yeah,
I work with a company called Falafel. They trained me how to do this procedure, and they have a phenomenal support team that will sometimes talk to these interested men for years, answering their questions,
yeah,
before these guys, let's say, decide to even schedule an appointment. And I love that because nobody feels rushed to get the procedure done. They're just open, they'll text them back and answer different questions because sometimes it takes years for someone to decide they want to proceed. So the majority of my patients that come in wanting filler are some of the most educated people I've ever met in my life. And I love that because then they have a foundation. So then we can use that time for the visit to really have a conversation about what they're looking to get with the filler.
yeah. I mean, it's different, isn't it? And I think that's the education part of it is important. I don't know that. I mean, you might have a different thought on this one. Are we ever going to get to the male equivalent of Botox parties that that women have and stuff like that? I mean, I think it's different, isn't it? Because it's it's in a hidden part of your body. You know, like you said, it sounds very safe, and is very safe and is non-permanent and all that kind of stuff. Um, but it feels like a big thing to do to inject something into your penis. So it's it's
Yeah. Well,
yeah,
it's very polarizing because you name it, someone's injected a whole bunch of different things into the penis. And
yeah,
some of those substances have real implications on that person's health. I mean, there are people that have died actually from certain things that have been injected into the penis. So
mm,
I understand why a lot of guys would be concerned. Also, when it comes to the penile enhancement space, it's like the wild, wild west, right? There are
right,
a lot of people doing a lot of different things. And just because someone has an MD behind their name or been doing it for a long period of time doesn't mean they have the best interests of the patient in mind. So I always tell people, doctor shop, like meet with different people, do your research. If you don't like the vibe of the person that you're going to see, then see someone else, right? And
mm,
if you feel pressure to come in for a procedure and get it done that day, then I would encourage you to see someone else. It was really interesting. I was seeing a patient, this was last week, and he came in to discuss filler. But like as we mentioned, I broadened the discussion. So I was meeting with him for it was like 2.5 hours, and I had a hard stop because I had to go to a meeting at like 11:30, and he came in at 9. So it was like around 10:30, and it takes me about like 30 to 45 minutes to do the procedure. And I said, okay, let me just pause for a second. I do have a hard stop at 11:30. Do you want to keep talking today, or were you interested in getting the procedure done today? Because then we can talk more about the procedure and get that done. And he said, "What do you prefer?" And I said, "I mean, I would prefer to talk." And he really appreciated that, So we spoke for 2.5 hours. I brought him in the next day. We spoke for like another hour, and then we did the procedure. But I think it's really important that, so I use filler as like this door that brings someone into the healthcare system. But
mm.
in the process of them coming in for filler, my hope is to change the trajectory of their lives by making them healthier people. Filler makes that easy to do because a lot of guys are coming in and they're, willing to listen, which is a
That's
beautiful conversation. Yeah.
yeah, that's really cool. So, how does that show up? Are you seeing people that are just generally more interested in their health after they've had a consultation with you? So, maybe they are sort of looking at the macros, looking at the hormones, um, you know, living more active lifestyles, that kind of stuff. Like, what do you mean? Are they? How does it show up, that improvement?
Yeah. Because so I have a practice, it's a concierge practice. It's with my twin sister, and she really delves into nutrition and medical weight
Yep.
management. And so, yeah, I mean, I give a lot of guidance on hormone health and sexual health. And a lot of these guys coming in for enhancement, they then want me to check their hormones, and then I manage their testosterone. And then I send them home with healthy snacks so they can make their best, their next better decision. So I look at it as a real opportunity. Now, there are
Yeah.
plenty of clinics where you go in and you're going in for girth enhancement and you're paying for a service and you leave and you got that service. And so I'm not saying that my clinic is any better than any of those other clinics. It just depends on what that person is looking for. And if a guy is coming in and really wants to have like this very well-rounded discussion about his health as a man and
Mm.
discuss different ways of having penile enhancement, then he's probably going to enjoy coming to a clinic like mine.
Oh,
But
absolutely.
everyone's looking for different things. There are some guys that don't have any interest, right, in having that nuanced discussion, and they just want to come in and get their enhancement and then leave. And that's so they might do better in someone else's clinic. But
Mm.
I have some guys where, I mean, literally the penile enhancement conversation could take 5 minutes. So if I'm getting the vibe the guy just really wants to come in and get out, then we'll just talk for 5 minutes and we can do the procedure. I try to tailor it to each person.
But honestly, though, like it's a rarity, really, that somebody would, or a guy, I think, would get that opportunity to kind of come in and talk quite openly and holistically about their health. So I think it's probably quite a nice thing to do. I would definitely appreciate that. And if it means talking about your junk, then so be it. But I like the fact that it's can be more holistic, especially when it comes to the sort of health and other health factors as well. Because sometimes going to the doctors is a bit intimidating. But also I think it's cool that this sometimes all it takes is is one thing to kind of kick you off on a health journey as well. Whether it's a blood test or signing up for a 5K run or a problem that you want to or that needs to be resolved through doctors such as yourself. Could just be that first step in a really good health journey. So that's kind of it. So that's really nice. Do you want to just whiz through where people can find you at?
Yeah. So my practice is located in Miami, Florida. I do offer second opinions. I do have quite a few international patients.
Yep.
So my website is primeinstitute.us. And then I have a YouTube channel that also discusses a lot of things about various men's health topics as well as enhancement, which we discussed today. We didn't talk about traction devices or penis pumps on today's podcast, but I do have some videos on my YouTube channel about those devices. And
That's
you can
that's my
find me
morning.
at Doc Amy Urology.
Beautiful. All right, I'll definitely go check that out. That's great stuff. Hey, thank you very much for your time and expertise. It's been really great chatting to you. And sounds like you're doing fantastic work. I'm very jealous. I'm so far away. New Zealand it's a bit of a flight, to come and see you. But yeah,
Yeah.
excellent. Keep it up. Thank
Thanks.
you very
Good to
much
see you,
indeed.
Tim.
Cheers.